let's go all the way to Indonesia. And I'm also honored, I'm very pleased to invite Professor Muhammad Miftahussurur, who is the Vice Rector of the University of Airlangga in Surabaya in Indonesia, for digitalization, internationalization. And these are two important topics, internationalization and digitalization. So he is the Vice Rector for those two important, very important topics. He's a medical doctor. He's also a well-distinguished scholar. He published and he has led many good health, public health research projects. He can talk to us. Yes, he's coming from science and medical background, but also he has tremendous experience worldwide, not just in publishing and being an author or an editor, but leading really serious research project. But the University of Airlangga, I'm sure he will speak better. I'm not here to, I cannot talk better about his university but it's one of the leading universities in Indonesia. And I think Indonesia is a country with a large number of universities. As far as I know, when I visited, it's more than 4,000 universities.
Yes.
And the University of Airlangga, I think, is one of the top 5, I think number 4 or 5, I'm not sure.
Yes.
But more importantly, what I was so impressed, and that's why I keep arguing when I go to meetings in America or in the UK or in the UN, there are universities in Africa or in developing countries like in Indonesia, their global ranking is higher than our British universities here ranking. So that can give you the idea of how people are working very hard. So the Airlangga University ranking in the global ranking is higher than several universities in the United Kingdom. So I will give you the floor, Professor. You are going to share with us the experience of such a top-class university. Is far away. I'm not saying by far away you are out of the world, but we have far away in terms of distance-wise. I thank you very much. I know it's too late there now. I don't know what time now, but I know it's evening. So the floor is yours. I already made you a host co-chair, so you can share. Can you share your slide, Professor?
Yes, thank you very much, Professor. I will share my slide. Could you see my slide?
Yes, just use the big show now. Yes,
okay.
Excellent.
Thank you very much. Good afternoon, good night, good in here, 5 p.m., 6 p.m. recently. A very warm greeting to all of you at the World Association Sustainable Development Conference this Wednesday. It is a great pleasure for Universitas Airlangga, Indonesia, to be able to participate in this conference with researchers, policymakers, educators, consultants, and also employers from around the world to exchange knowledge and experience, as well as discussing recent developments and current challenges, especially pertaining COVID-19 pandemic. Today, I would like to highlight these 2 points. First, I will deliver a brief introduction about our institution, and I will explain afterwards about the challenge that our institution has faced due to the pandemics. As a comprehensive university, Universitas Airlangga is comprised of 14 faculties and 2 schools with a total of 173 study programs across the world, across different campuses. And our study programs range from medical and health science, life science, technological science, as well as social and humanities science. With 39,197 students, Universitas Airlangga is supported with 1,930 lecturers per September 2020 and 2,085 administrative staff, and we are truly committed to increase their well-being. Ladies and gentlemen, to ensure our administration system meets the standards, we have established what we name the Airlangga Integrated Management System, or also known as AIMS. Our quality assurance both monitor the results and performance of all work units through establishing an up-to-date procedure guideline in all areas. Most of the study programs in Universitas Airlangga are accredited A by our national accreditation body. However, Universitas Airlangga always encourages its faculties to improve the quality of education by conducting international accreditation as well. We have several numbers of international accreditation already, such as IWA, Malcolm Baldrige, and also ISO. And also, based on the QS World University Ranking 2020, among esteemed universities in the world, Universitas Airlangga is ranked 521 to 530 worldwide and 171 in Asia. Whereas in Indonesia, Airlangga is considered as number 4. In addition to our subject, medicine and business and management studies are ranked in 551 to 600 and 551 to 500 respectively in the world. They are a reflection of our continuous endeavor to strive for quality improvement. And moreover, Time Higher Education Impact Ranking, Airlangga has been ranked in 301 to 400 in the world. With regard to supporting sustainability and green campus, UNER or Airlangga aims to improve itself in ensure green practice with its campus as well as within all aspects of campus life. At the moment, Airlangga is ranked 255 in University Indonesian Green Matrix. Ladies and gentlemen, Universitas Airlangga has a vast network of partnership on both national and international levels, as well as global consortiums. On international level, our active partnerships are comprised of more than 200 partnerships globally. And for its global networks, Universitas Airlangga is involved in several collaborations. And the partnership take many forms, such as human resource recruitment, joint research, student, lecturer, and also STEM exchange, including double degree and many other forms of mutual collaboration. I would like to introduce the Academic Health Science Institute as a model for interprofessional education and services Universitas Airlangga. Academic health system, or we call AHS, is an organizational network that consists of medical, and health faculties, teaching hospital, research institutes, private sectors, and also local government. AHS become part of health education system integration to provide the best health outcomes to society through health education and also transnational research that will impact the continuous quality improvement for healthcare. With the help of the agencies, institutions, organizations, and donors, Universitas Airlangga Alumni Association also present Universitas Airlangga Floating Hospital and as an additional to service for medical care. Satria Airlangga, the name of Universitas Airlangga Floating Hospital, was initiated by colleagues from our Faculty of Medicine and its Alumni Association to help and complement health services from the government, especially for the remote islands. Now, there we move on the second highlight. I would like to underline some aspect regarding the barriers or challenges that our university has to go through and I believe that other higher education institutions has been preoccupied with the same situation as well. Here I will list all the Universitas Airlangga's effort in trying to cope with the new normal in post-COVID-19 area. During the pandemic, concern about health issues have become more intense than ever. In a way, this is actually good because everyone is certainly become more aware and caring. However, at the same time, this creates challenges, in which there is no more direct interaction amongst people, and it eventually leads to limited physical mobility. This requires university to think out of the box to innovate how university can still achieve its target despite the limitation. Of course, we have a crisis. So in trying to cope, we are focusing on the 3 pillars of education, which including research, education, and community development. Since we are focusing on coping in the era of post-COVID-19, we redirect most of our researchers towards the relevant study. Time of crisis also call for innovations, and most of our existing programs have been based on credit earning and also or credit transfers, or most of them are infused with the cultural STEM activities. With everything now converted online, we focus on improving virtual engagement and try to find our way around virtually designed programs. Ladies and gentlemen, Universitas Airlangga has research center, hospital, animal center, and which most had been shut down as the impact of COVID-19. With the most of our experiment facilities being shut down, we are focusing on research. We do not involve any sorts of experiments, thus does not require researcher to actually come into the lab. On the following slides, I will show a list of UNER researchers through 2020, which have been all directed on COVID-19 topic. It is the first that this research focus on observes the correlation between meat consumptions and the number of COVID-19 cases, then comparing in the case US and also China. This study shows the high number of mutton imports is actually related to the reduction number of active cases in both of countries. And the next, this research focus on observing the relation between trends and information about death, the reason that caused the trends, and as well as its benefit to COVID-19 case in sample of the study. And the study shows that such trend is indeed more popular in Saudi, mostly due to the cultural and religious ties. And this is the research focusing on serology methods of COVID-19 screening and diagnosis method in developing countries. This research figures of the order for serology methods being considered as an effective screening and diagnostic methods to detected targets should be either antigen or antibody. And it should be underlined that antibodies have higher sensitivity. The time of the sample collection and the specimen type also determine the efficiency of such tests. And also the next, this is the research focus on how social media has been utilized as a tool to seek social support and the accessibility of such platform to be able to connect people and share information in times about pandemic. It is the very interesting research that 4 variables with us affect psychosocial burden amongst community in Indonesia, which consists of age, gender, education, and employment. And the next is the research is trying to delve deeper into the various aspects of the asymptomatic cases, since such understanding will be the main consideration when it comes to formulation better national health policies, especially in Indonesia. And maybe this is the last, is the researchers focus on the risk factors contributing the psychological impact, which include age, gender, education, background, economic, support system, health, whereas social stigma is mostly affected by environmental factors, medical history, discrimination, self-isolation, as well as people perceptions. I'm sorry, this is actually the last research is studied about the new mathematical methods. It is very interesting how for the dynamic of COVID-19 with quarantine and also isolation, and further shows how fractal fractional order model provides the best fitting to the reported case. And this is the situation before COVID-19, that collaboration in conducting China's teacher training in workshop, and also Airlangga hosted Taiwan Higher Education Fair, and collaboration in Airlangga in Global Day as exhibitors and sharing session study in Taiwan. But after that, we changed of the situation after COVID-19, collaboration in conducting Chinese teacher training by workshop online, also webinar with expert in specific academic with nanotechnology with TechSeed, and also online storytelling competitions on Airlangga Global Day, also by online. It is of course it will become the in the future many workshop and many modification due to the COVID-19 will become our priority. Ladies and gentlemen, this is what we hope one of the earliest creative online program initiation this year. We call is COP or COP, where students participated in a community development-based activity and had to propose alternative to real-life case presented throughout the program. With this slide, I will also inviting you all to join with us about community outreach program. And this year, COP, in the third COP actually ever held and become the first online It is our first online because due to pandemic, community outreach program that Airlangga has conducted under the Asia Uninet framework. For this year in particular, COP was designed around real-life case of stunting, and with the aim of trying to upload the prevailing SDGs. COP opted to have stunting prevention acceleration as theme. The program involved both students and also academic staff to team up together to find the best solution to stunting problems in Indonesia in particular. And then they spent almost a week exploring the issue with Indonesian local head communities. Very interesting. And also before COVID-19, we had Bahasa Indonesia language class for students. Please join with us, including beginner and also intermediate level. Training for trainers for Indonesian language lecturers for teaching in beginner level, and we even sent Airlangga books collection about Indonesia in multiple perspectives. But during COVID-19, we reformatted our learning Bahasa Indonesia program for international students from face-to-face activities to an online program, where aside from learning Bahasa Indonesia, students can also share their knowledge on Indonesian culture and gain more insight about Indonesian culture. We also got to conduct a webinar for international students, inviting international alumni to be guest speaker in sharing session about study during pandemic. And some of the recent webinars have also talked about global academic mobility, and we focus on trying to build a sustainable global academic cooperation frameworks regardless of limitation. And before COVID-19, we held guest lecture, actually series for international students, talking about particular academic subjects and were delivered by UNER Airlangga academics. In the post-COVID-19, we tried change. We held a series of online global classroom delivered by UNER academics. And since everything was conducted online, we had the opportunity to explore a wider range of academic subjects, albeit remotely. Such as here, we have like a psychology class, which talk about how to maintain the mental health during a pandemic. A part of student-oriented programs, our educational sector also focuses on trying to engage our global partners steadily through several global scholars program. We invite you all to join what we call Dekota or video conferencing with Universitas Airlangga program. You can propose the topics and also propose what call, and we can make a special conference for you with Airlangga Global Engagement, and we invite your distinguished scholars to teach or to provide guest lectures, albeit online. And apart from teaching-based Airlangga Global Engagement, also introduced we call APD. I also invite you as Airlangga Postdoctoral Fellowship Program. This is postdoc by online, which invites academic to conduct research activity with our prominent professor or researchers. Both Dekota and APD here opens throughout the years, and we welcome any of you to participate in our programs. Engaging the academic peers is also one way to cope with the post-COVID-19 era, and with regards to three pillars of education, academic peers easily become the most sustainable partnership hub in times of struggling to keep up with this new phase called new normal. And this is additionally, we also trying to expand our networking chain from various virtual exhibition, where we can engage with potential partners for potential collaboration. We've participated in the virtual KS, SFS, and KS Maple this year, and we are going to join KS Apple on upcoming November 25 until 26, 2020. We hope you are joined in this meeting, and we are also preparing our very first virtual exhibitions, which is going to be part of our institution anniversary next month. This virtual exhibition, namely AGD, is now called for contributors, and we welcome for all our partners to participate. Please join with us. And coping with the new normal also means combining every available resources with the implementation of interprofessional education. We are combining academic activities, research activities, as well as community development in one setting. And to overcome the physical mobility limitation, the interprofessional education is being conducted virtually. It is very interesting, the first for us. And from the academic activities, we compile and formulate the curriculum setting, which include active course on interprofessional education. In term research activities, we have interprofessional education module for social topics on urban, and also digitalization and pollution, ecotourism and leadership. And whereas the implementation of community development activities is mostly conducted in community settings, and the implementation of interprofessional education is basically part of how we design our future programs and collaboration. I think it is our last slide. Coping with the era of post-COVID-19 means directing our university to be an HPU, or health promoting university. This theme will involve 5 components to be well considered about, from the commitment and policies of university leaders, of course, which in turn shall provide the baseline for social and physical environment, which support healthy behavior and result in healthy staff as well as healthy university student. And we are also considering our teaching and learning activities, research activities as well, to be more in tune with the current health and safety protocol. And we are putting more focus on supporting and improving the individual's wellness in our campus. Thank you, Professor Alan. This is our picture, our hospital during pandemic 19. Thank you very much.
Thank you very much, Professor Muhammad Miftahussurur. That's an excellent presentation. I have to follow all of you. Can you,
Professor Alan?
Yes, go ahead.
May I try to answer Professor Nyai about the...
Okay, you can go. You go ahead with that question. Yes. So the question is, he said, Professor Natai said, research on the efforts of COVID-19 on people psychosis is threatening. Kindly advise on how your model can be used to restore their health and well-being. Go ahead, doctor.
Yes. Actually, thank you, Professor Alin, that actually Indonesia have a very wide COVID-19 infection, and this study actually very interesting because they make a distributing online survey to Indonesian citizens in 8 days actually, from June 6 to until 13. And the final number of respondents was 8,031 respondents. And they tried to find what kind of the variables associated with the community psychosocial burden or anxiety level during the COVID-19 pandemic in Indonesia. And after they have like 5 questions, including how you're feeling on social relationship, how would you describe your feeling in your economic situation? And they have the score 1, 2 to 5, and the 5 is very worried, and 1 is not significantly worried. And also they try to find the what kind of the variables that really associated with the anxiety. And finally they find that the age, also gender, education, and also employment is the most factors and influence to the anxiety during COVID-19. And they give the recommendation to Indonesian government to develop mental health programs. Actually, we are, although I'm an internal medicine doctor, maybe sometimes I forget that the COVID-19 also make mental health problem. So they suggest to our government, please develop mental health programs during the COVID-19 pandemic. And with this suggestion, our university now make a special team to focus on the developmental program for all over our country. Thank you very much.
Okay. Any other question? Any question? You all unmuted now, so you can ask your question.
May I, Alam?
Yes, go ahead, Petro.
I don't have a question, but I noticed on the chat a kind of question from Professor Ntai. So I'd like to respond. You know, the United Nations is a big thing. It's everywhere. It's headquarters, many, more than 50 entities. But to get in, to really enter into some partnership, as Professor Ntai suggested, you know, one should address the United Nations family in the respective country. In Indonesia, there is a powerful and important country team. We call it country team in the sense that many United Nations organizations are present. So I would suggest that the first step is to be done by contacting this country team, because they are more aware of what are the needs of the country and what are the points of interference between the energy programs of the university, of any other programs, and the priorities of the country team. And they can explore together possibilities for partnership. In principle, all these country teams should be open to partnership in the countries they serve. Over to you.
Because I read that question and I wanted to add to it, is that we will share with you, they have their website, the Joint Inspection Unit, but as Petro said, the UN got different agencies, and these agencies are spread in each country they have. So for example, in each country, you'll find the UNDP, WHO, and so on and so forth. We were supposed to be in Kenya last year for the UNEB, but because of issues to do with safety and so on, we couldn't go there.
So please remember, if we all help and do a little bit, it will make a big difference.